Hi, Lexi. It's so great to have you. I'm Shannon Decker, and joining me is Lexi Cole. She is a graduate student interning with the Speedy Foundation this semester. Lexi, will you tell us a little bit about your education at Boise State and kind of like your career goals or trajectory?
Yeah, of course. Thanks for having me. I'm Lexi. I'm a graduate student getting my master's in public health at Boise State University. I got my undergrad in health studies in 2022, minors in psychology and family studies. And during those classes, it really just got me more excited to work at a population-based level. And that's what made me interested in going into public health. Um, have always grown up with the prevention mindset with my mom being a holistic doctor. So I just love looking at problems and looking at it from a bigger perspective. And that's kind of what got me excited about public health. Working with some of the organizations during my public health career or education has really got me excited to work in maternal and child health field or youth mental health field.
Awesome. And Lexi has also been working for Communities for Youth in the Treasure Valley. So could you just share a little bit about what that initiative is and kind of your role with that?
Yeah, so Communities for Youth is my graduate assistant position, and it's the name of an initiative looking at upstream prevention and youth well-being. So basically, a lot of the work we do is collecting data from the youth voice and really trying to understand what they're going through and then getting that data back to the schools within a 2 week to a month periods, and then working with the community members to try and create change where we see it's fit. In the Boise County, or not county, Boise City, two of the main factors that are leading in the youth is social isolation, stress. So there's been a real push to create social connection in this community, and it's been really cool. We just had a teen takeover event with Jump, which is Jack's urban meeting place. And it was a place that we allowed the youth to connect with having live music and bands and other connecting opportunities like coloring, t-shirt making, just a safe place for a large gathering.
Awesome. Love it. So this semester, Lexi has been conducting some data dives into helping to create some supplemental resources for the Speedy Foundation's like gatekeeper trainings. She's also done a capstone project around suicide prevention called Understanding Suicide Prevention Factors in Neurodiverse Populations. So Lexi, I'd love to hand it over to you to kind of walk us through that capstone project and how it's turning out, any fascinating things that you've seen in the research.
Yeah, it's been super interesting being able to work on this population because I don't really have much of a background in it. So it was definitely like diving in um, from just beginning. So at first I was looking at the 988 website, and it was like general things. And then there was also like a neurodiverse section, which was amazing, just to see how different factors there are. Um, Neurodiverse populations can include like ADHD, autism, and a variety of other um, symptoms and diagnoses. So I can go into my poster and just
Yeah,
lay out a few things if that works.
that would be awesome.
Um, Awesome. Sorry, 2 seconds, share screen.
No, go for it.
Okay. So, my project was mostly I guess I can present it. Was a
Want me
lit
to-
review. Um, and I was looking at a bunch of different websites and research articles. A lot of them are mainly done in the UK. So just some background, suicide is one of the leading causes of death in neurodiverse individuals.
Lexi,
Neuro Yes.
really quick, 1 second. Is it still loading on your end?
Oh, it's showing.
It's showing. My screen isn't showing yet.
Okay. Oh, let's see. I could exit out of it and just do it on this too.
Okay. I just don't know how the recording will capture it.
Resume share. I'm gonna say stop share. Sorry.
No, technical difficulties. It's okay.
Technical difficulty. Okay, I'll do this again. Let's do, how's that?
There we go. Okay.
Okay, cool. I'm just gonna keep it in this format if that's okay.
That's perfect.
Okay. Um, so neurodiversity is the variation of cognitive functionings and how everyone has a unique brain with different skills, abilities, and needs. So basically, I was looking at evidence-based strategies aimed to tailor suicide prevention specifically for neurodiverse populations. Um, and so why is the risk higher for neurodiverse individuals? I more specifically dove into the autistic population, which shows autistic people are 7 times more likely to die by suicide than the general population.
Mm.
Some of the risk factors include social challenges, like earlier discussed, social isolation is a big one, rejection, bullying, camouflaging was something that came up that was new to me. A
Mhm.
lot of the factors of like autism diagnosis are aimed towards male symptoms. So a lot of women and girls get passed by and they end up camouflaging some of their like symptoms that relate to autism, which then leads to a later diagnosis, which shows in this statistic right here, approximately 66% of late diagnosed autistic adults had experienced suicidal ideation. And I thought that was a really interesting factor of how can we start noticing some of these symptoms earlier for different individuals. Co-occurring mental health conditions was also a really big one. A lot of people that have diagnoses may experience other diagnoses as well, which just can further affect mental health
Yeah.
conditions. Sensory sensitivities, difficulty accessing support services, and transitional periods, stigma and misunderstanding. And kind of what I've realized is the protective factors are kind of the opposite of that. So having strong social connections, self-identity, acceptance, structure and routine, predictability is important as well.
Yeah.
And educating others about neurodiversity, so we can be more, have a more accepting community and have those areas where we can help people that need it.
Yeah. I mean, that's how we really
Um,
start to change the culture and destigmatize things, especially for this unique population.
exactly, yes. And then common warning signs I found interesting because it can relate to the general population as well. Just increased withdrawal, um, no words to communicate acute distress, uh, other traumatic events going on,
Hmm.
increased rates of self-harm or worsening levels of symptoms, new focus on suicidal talk
Hmm.
or ideation or death-related topics, and seeking means or making plans for attempt, and statements about no reason for living. Which these are just common warning signs, I think, to the general public, along with neurodiverse individuals, just being aware of these uh, topics of conversation. And some strategies to support. This was an interesting topic that we got to kind of dive a little deeper in with Shannon being able to share some autism specific safety plan. Um, at first, it was the main one that I found was just through 988, and it was the general population. I think it's Stanley Brown, what is
Hmm.
it? And we got to take another look into it, and actually, I could pull it up right here.
Great.
Um, so this is the safety plan that's specific for mental health and autism that Shannon was able to share with me. And I think it's really interesting that some of the main things in the safety plan is for the individual to have and be able to go back and look at it, but like, which the first question is my reason for living, which is amazing to be able to bring you back to this is something that I know is specific to me as an individual, and that will keep me safe, and I can remind myself of these things.
Yeah.
Um, and then some of the other things go into warning signs that the person may have, um, feeling the urges to end their life, and what can they distract themselves with, who is a person that can support them, people that they can contact to ask for help, and just having it written down. So maybe if it is a crisis moment, you can go back, reflect on that, and know, okay, yes, this is somebody that I can go to. And actually, a lot of my data is found with Sarah Cassidy, who's a UK researcher. And she's been able to dive deeper and deeper into the topic, going from a general topic to more in depth, which is amazing.
Yeah.
Um, Professional agencies that they can contact and making the environment safe, and how other people can support. So maybe you can go and talk to somebody that you feel safe with and say, this is what I may need. Um, in times of crisis, which
Yeah.
I just think this is really in depth and great. And then going into more um, specific ones, that questions: how can you help me calm me down?
Yeah.
What makes me unhappy? How I like to communicate?
Yeah.
Um,
So just to add on to this, the McCall family is the group who sent me this resource, which is phenomenal. Sadly, they lost their daughter, who was neurodivergent to suicide, and they're doing what they can to bring awareness and to dig up the research or promote research in this field. So this is essentially the Stanley Brown safety plan, but it's formatted differently. Like there's big boxes instead of lines, because we know that, some people with neurodivergent thinking, they might have um, the ability to draw as opposed to write. They might have different, different capabilities when it comes to handwriting. Um, and the order in which this is laid out is different. The Stanley Brown safety plan usually ends with the supplemental question of, what are my reasons for living? But I love how this one starts out with, what are my reasons for living? And it's just rephrased to have better speak to somebody with neurodivergence. So this was a great find, and I really appreciate them sharing it with us. We have found that resources are hard to come by. Lexi, what are, any of the other resources that you thought were really good that we saw out there?
yeah. So there was also, Sarah Cassidy, the one that that researcher, also discovered that there are the see, now I'm forgetting the letters. QBR is the suicide risk. It's like a survey kind of, and she found that the general population survey is not as effective as one that's specific for neurodiverse populations. And there's a lot of questions in, or it's about 4 questions. It's 4 questions long, the general population one, and it's asking about um, past behaviors, past thoughts, or long-term future. And in the research, it talks about like qualitative data where um, the individuals say that's not effective for us because we don't like think that far, like remember how we were feeling back in the past, or are planning for the future that far ahead. And the questions need to be kind of more specific of what's going on right now. How am I feeling right now? And I thought that was really interesting because we need to make sure that the material that we're getting out there to get this data is being like understood correctly. And that goes into like health literacy and how we
Yeah.
can make that effective for every population that we're trying to deal with.
And that would be a suicide screening tool. Is that right?
Yes, thank you.
Okay.
I was all
Cool.
like trying to come up with the yeah,
Yeah.
suicide screening tool.
Okay.
And she's been able to develop a more neurodiverse specific screening tool, which is more in depth, and it's free to access online, which is great. and being able to print it for individuals. A lot of this information, I would say, is for like the general population to get like to be able to share more knowledge. We can also do this at like um, kind of more educators, so more educators are aware of some of their student population, and also kind of like I would say even policy, just being able to have this information easily available and affordable for people who are looking for it.
Right. Yeah, and scaling it across healthcare systems so that, providers,
Yeah.
when they're interacting with neurodivergent individuals who are, elevated with emotions or potentially suicidal ideation, suicide attempt, that they've got the tools as well.
Yeah.
Awesome. Any other takeaways from your capstone project?
Um, it's just been really interesting being able to dive deeper into this specific population, and how important this is, to focus in on to make sure that we're being able to address every population and give them the needs that they need. So yeah, thank you for the
Awesome.
opportunity. Yeah,
Yeah, well, thank you for taking time out of your semester to work with us on this topic and bringing resources together. We will put these all together in a blog and add some of the key, pieces, the screener, the safety plan, and some of the other U.S. and international resources that we found. So. All right, Lexi. Well, congratulations on your upcoming graduation, and we are here to champion you as you launch into your career in public health.
thank you so much.
Thank you.